The COVID-19 pandemic changed healthcare forever. But what does the future hold? Will telemedicine become the norm? Will hospitals be better prepared for future crises? The pandemic exposed weaknesses, but it also accelerated innovation. From digital health records to AI-driven diagnostics, the industry is evolving fast. Are we heading toward a more efficient, patient-centered system, or will old problems persist? Let's dive into the future of U.S. healthcare. Telemedicine skyrocketed during the pandemic, but will it last? Virtual doctor visits made healthcare more accessible, especially for rural areas. But challenges remain: insurance coverage, technology gaps, and the need for in-person care. Will policymakers push for permanent telehealth expansion? Or will we revert to pre-pandemic norms? The convenience is undeniable, but can it replace traditional healthcare? What do you think? The U.S. healthcare system struggled with supply shortages during COVID-19. Masks, ventilators, and even basic medications ran low. Will we be better prepared next time? Some experts call for stronger domestic production and stockpiles. Others argue for better global supply chain coordination. Can we prevent another crisis, or will history repeat itself? What's the best way to ensure hospitals never run out of critical supplies again? Healthcare workers were hailed as heroes, but many faced burnout and exhaustion. Will the system change to support them better? Higher wages, better working conditions, and mental health resources are needed. But will hospitals and policymakers step up? If we don't invest in healthcare workers, who will care for us in the next crisis? How can we ensure they get the support they deserve? The pandemic highlighted racial and economic disparities in healthcare. Low-income and minority communities suffered the most. Will the system finally address these inequalities? Some propose expanding Medicaid, increasing funding for community clinics, and improving access to preventive care. But will these changes happen, or will disparities persist? How can we create a healthcare system that truly serves everyone, regardless of income or race? Artificial intelligence is revolutionizing healthcare. AI can diagnose diseases, predict outbreaks, and even assist in surgeries. But will it replace human doctors? Some fear over-reliance on technology, while others see AI as a tool to enhance care. Will AI make healthcare more efficient and accessible, or will it create new ethical dilemmas? How do we balance innovation with human expertise? Prescription drug prices remain a major issue. The pandemic showed how vital affordable medication is, but prices keep rising. Will the government step in with price controls? Will pharmaceutical companies prioritize accessibility over profits? Some advocate for importing cheaper drugs, while others push for more transparency in pricing. What's the best way to ensure life-saving medications are affordable for all? Mental health care became a priority during the pandemic, but will that focus continue? More people sought therapy, and telehealth made mental health services more accessible. But insurance coverage and stigma remain barriers. Will mental health finally be treated as seriously as physical health? What policies or innovations could make mental health care more available to those who need it most? The pandemic forced hospitals to rethink emergency preparedness. Some built overflow facilities, while others improved ICU capacity. But will these changes last? Future pandemics or disasters could overwhelm the system again. Should hospitals permanently expand capacity, or is that too costly? How can we ensure hospitals are always ready for the unexpected? Health insurance remains a complex issue. Millions lost coverage during the pandemic, exposing flaws in employer-based insurance. Will the U.S. move toward universal health care, or will private insurance dominate? Some advocate for a public option, while others fear government overreach. What's the best way to ensure everyone has access to affordable health care? Vaccine development broke records during COVID-19. Will future vaccines be developed just as fast? mRNA technology changed the game, but will it be used for other diseases? Some worry about safety, while others see endless possibilities. Could we see rapid vaccines for cancer, HIV, or even the common cold? What's next for vaccine innovation? Public trust in healthcare took a hit during the pandemic. Misinformation spread rapidly, and many questioned experts. How can trust be rebuilt? Transparency, better communication, and combating misinformation are key. But will people listen? Can healthcare leaders regain public confidence, or will skepticism continue to grow? Wearable health tech is booming. Smartwatches now track heart rates, oxygen levels, and even detect early signs of illness. Will these devices become essential for healthcare? Some worry about privacy, while others see them as life-saving tools. Could wearables reduce hospital visits and improve early disease detection? Would you trust a smartwatch with your health? The future of US healthcare is uncertain, but one thing is clear: change is coming. Will we embrace innovation, or will old problems persist? From AI to telemedicine, from policy shifts to new treatments, the choices we make now will shape the future. What do you think? What's the most important change needed? Like, share, and subscribe for more deep dives into the issues that matter.